Okay. You ready? Okay. All right. So we're going to RSI this patient. We're oxygenating, we're ventilating, the patient's on the monitor, we cycle the blood pressure. We're doing nice, slow, deliberate oxygenation and ventilation. Okay, we've got good technique. I'm moving, I can tell I got chest moving up and down. Okay, and drugs are being pushed. We pushed our ketamine, our rocuronium, and now we're starting a timer for 60 seconds.
Okay, got the 60 seconds.
So we'll pretend like it's almost 60 seconds, okay? They feel like they're getting looser on their jaw right now, okay? So 60 seconds is up, okay? I'm gonna take off my mask. I'll put it up here so y'all can help me and do it in a second. If I have an oral airway, I'm gonna remove that right now. I'm gonna pick up my laryngoscope. I'm looking, I'm feeling the jaw relaxed. I'm looking in the mouth. If I see secretions, I'm gonna go ahead and grab my suction and do a quick suction. If I don't see secretions, I'm not gonna worry about it. I'm gonna take my free hand. I'm gonna go in the mouth on the molars. I'm gonna scissor that mouth open. And that's gonna allow me to get my blade in, either straight on the right of the tongue, 45 degree or 90 degree, it doesn't matter. I typically go in at about a 45 degree angle to get that blade on the right side of the tongue. So I'm getting good tongue control. I'm slow, I'm deliberate, I'm looking at anatomy. Down here, I'm gonna lift, I'm taking my fingers out of the mouth, I'm looking at the camera now to see what I see. I'm gonna back up if I'm too deep. There's tip of epiglottis, there's vallecula, I'm gonna lift in the vallecula. Now I've got a nice full view of my glottis, okay? So if I needed to, I could use my free hand now and come up and do external laryngeal manipulation, straight down, right, left, and have my partner help see my view and optimize my view when I let go. Okay, I've got a good view, I'm happy. I'm gonna take my bougie now, please. Take my bougie. I'm gonna look here, not looking at the camera, I'm looking down here now. I'm gonna watch it in the corner of the mouth, go down around the base of the tongue, okay, by the blade. Now I'm gonna look up and see it come into view. I wanna slowly push towards the cords. I'm staying down here by the mouth, so I have good control of the bougie. I'm gonna twist it left or right if I need to, pop it through the cords. I'm feeling for rings. I see it between the cords. I'm gonna cheat a little deeper and know I'm in the airway. Go ahead and load my tube, please. I'm gonna leave my blade in the whole time. He's loading my tube. Bring the tube down. When it gets to my fingers, I take over, let go. He can let go of everything. We don't hold on the bougie, we let go of everything. I've got control of the airway. I'm looking at the teeth now. As I pass the cuff over the teeth, I'm going slow and deliberately so I don't break the cuff. We break a lot of cuffs in the field scraping past the teeth. So I've been looking here in the mouth, watching go past the teeth. Now I'm gonna look up at my camera. I'm gonna inch it down by the mouth down here where I have good control of the tube. I'm gonna twist if I need to, push over the bougie, through the glottis. I felt it go through, I saw it go through the cords. I'm gonna go a little deeper, hold the tube tight. I see it, everyone agrees we're in. I'm gonna pull my blade out gently, turn my camera off, take my own bougie out so I can hold my tube. Take my own bougie out. Last step, back it out where I want. If this is a male patient, I'm gonna come to about 23 at the teeth, okay? If it's a female, maybe 21 at the teeth. Go ahead and inflate my cuff, please. And attach the ambu bag. Cuffs inflated, I'm holding the tube. My assistant is grabbing the ambu bag. Go ahead and breathe, okay? You go ahead and auscultate. I wanna feel chest rise up and down as you squeeze the bag. I might get fogging in the tube if it's cold enough. Auscultation, and we want 8 or 10 good breaths and look at capnography. We're gonna confirm with capnography. Okay, now you can get the tube tamer and go ahead to secure the tube, now that we're happy. Okay, and then just be careful when you're putting the tube taper on that you don't push the tube deeper. Keep it at that same depth. Okay, and always double check your depth, okay? All right, and then we take a blood pressure.
Did you have critical failures? Could you reiterate those?
So the critical failures, again, is failure to have everything ready to go out, equipment checked and out. We visualize all the equipment. Failure to get vital signs on the patient and optimize the patient with IV fluid bolus and push dose pressors as needed. We have adequate IV access with a second access site, either IO or another IV. We have our drugs labeled and drawn up, pushed correctly in the correct sequence. Wait 1 minute is another critical failure. Let the rocuronium take effect. Scissor the mouth open, that's a critical failure. Make sure you have a free hand, laryngoscope in the left hand, free right hand, scissor the mouth open, good tongue control. Lift, suction as needed, look for the anatomy, drop your bougie. A critical failure is now pulling the blade out after the bougie's in, so you want to leave the blade in through the entire RSI sequence, okay? Bougie's in, have some assistant load the tube, you take over, everyone lets over. Critical failure is people holding the end of the bougie. You gotta let go of the bougie. I take over control of the tube now, I get the tube placed down through the glottic opening. I agree, everyone agrees, we see it through the cords. I hold tube, I pull my blade out gently, I pull my bougie out, I pull the tube back out to where I wanna tie it in, or tube tamer it in, and then I put the cuff up. Okay?
Thanks, Doc.